in continuation to the lecture series on Insight about Rudimentary Solid Dosage Forms, powders, we will be continuing with the other topics to be covered under this unit. I am Dr. Hema Chaudhary from Kyarmangalam University. As already introduced the topic rudimentary solid dosage form, it is a basic form of medication which is designed to be taken orally. As it is a simplest form of dosage form, it is also simple in composition and it does not involve complex manufacturing processes. As the name indicates, powders, these are the dosage forms which are dispensed in its original state of fine subdivision. We have already discussed briefly in the past series about the classification of powders. The classification can be based on three different types. The first concept being based on composition, which we have already discussed as either simple divided powders or compound powders. The second criteria of classification is physical form, wherein we classify the rudimentary dosage forms as powders, granules and molded forms. And the most classical and the most used form of classification is based on route of administration into either topical, that is for external purpose, or it could be under oral category and or it could be on body cavities, which also comes under external. Today's topic we would be touching more on oral bulk powders. We have already discussed oral divided powders, and powders enclosed in capsules will be dealt under the unit of solid dosage form capsules. After completing oral bulk powders, we will be taking up topical powders or powders meant for external use, wherein we have the most important type being dusting powders. So as already discussed about powders which are meant for oral use or internal use, we have the first type called as divided powders. As the name itself signifies, divided. Divided means the dosage form which is to be taken in a day or for 24 hours is divided into number of packets. So basically, to introduce divided powders, it can be considered as these are powder drugs or potent drugs which are dispensed as divided powders. When I mention potent, it reflects that the drug is very effective in very small quantity. Such drugs we refer them as potent drugs. Now when we talk about oral divided powders, we have two type of subdivisions as either simple divided powder or compound divided powder. The basic difference between simple divided powder and compound divided powder is based on number of ingredients present in the powder prescription. If we talk about simple divided powders, it generally has one component or one ingredient as the main drug. When we talk about compound divided powders, it is a mixture of two or more active ingredients. So here the prescription will have more than one ingredient. So that is why it is called as compound powder. And both the cases, whether it is simple divided powder or compound divided powder, the dose of the drug for a day is divided into 2 or 3 doses as per the demand of the disease or the condition of the patient. So the main emphasis on today's series would be on the bulk powders which are meant for internal use. Now when we talk about bulk powders, basic difference from divided powders is divided powders are given in divided forms, whereas when we talk about bulk powders, these powders multiple doses are packed into a single container in bulk form. That is why they are called as bulk powders, and since the route of administration is internal, they can also be considered as bulk powders for internal use or powders which are intended to be given orally and they are dispensed in bulk form. The basic difference between oral powders, divided and bulk, as very obvious, divided is for potent drugs whereas bulk powders is for non-potent drugs. So basically we introduce bulk powders as non-potent drugs dispensed in bulk containers. It is very logical that when the quantity of drug to be dispensed is larger, packet made up of papers cannot be used. Rather, glass bottles or plastic bottles are suitable to pack such powders in containers. When we talk about bulk powders, we have two types of subdivision. The first being called as non-effervescent type of bulk powders and the second type as effervescent type of bulk powders. When we talk about non-effervescent type of bulk powders, we generally have examples of antacid powders, or we also have example of kaolin powder, which is an anti-diarrheal powder. And when we talk about effervescent type, the most classical example is effervescent granules, or in general terminology we call them as ENO, which is marketed. So whenever we have to introduce bulk powders for internal use, we basically highlight that these are those kind of prescriptions having non-potent drugs. So that means these drugs are very effective and these drugs are safe because they can be tolerated in larger quantity. So because of their non-potent behavior, it is also possible that slight variation in accuracy of dose can be tolerated. So yes, it is very much required that dose accuracy is maintained, but slight variation, because as household measures are used, like a spoon is generally used to take the powder quantity as a dose, sometimes there may be a slight fluctuation. So this can be tolerable whenever we talk about non-potent drugs. As already mentioned, bulk powders for internal use are generally dispensed in bulk containers. So this is a big container having multiple doses, and generally these are wide-mouthed, plain in nature, or amber glass containers are used. The purpose of having wide-mouth bottles is for ease of withdrawal of a particular dose. And sometimes a measuring spoon is also supplied with oral bulk powders, so that the measuring spoon will be helpful for the patient to withdraw an accurate amount of dose from the bulk container, thereby maintaining the purity of the drug which is packed in the container. Now when we go deep into type of bulk oral powders, we have the first type, non-effervescent type. So as the name indicates, these are the powders which do not show any kind of effervescence when they come in contact with powder. As any dosage form which is to be taken by oral route or by mouth, generally we need water, a glass of water, in order to consume the solid dosage form. Nowadays we talk about tablets and capsules in general, but it has also been seen that even today powder dosage form are in practice. So whenever we are talking about non-effervescent type, these do not cause any kind of effervescence when they come in contact with water. Generally these are large doses kind of dosage forms because they come under bulk categorization, and the most common type of examples which we see in the market or most popular examples include antacid powders like magnesium trisilicate powder, chalk powder. Now these are the powders which are generally recommended to a patient in case of acidity. We have anti-diarrheal powders, the example being powders having kaolin alone or kaolin pectin powders. Now these are also very advantageous whenever a patient is suffering from severe or profuse diarrhea. So anti-diarrheal powders are recommended in order to combat such a situation. Then we have most common and the most popular, which is generally recommended in bulk form, is electrolyte powders. So post dehydration or post diarrhea, generally a patient is dehydrated. So in order to rehydrate such a situation, electrolytes are recommended. So these are all bulk powders because they are packed in larger quantity in a single container, and very obvious that these are meant for oral use, so they are generally swallowed with water. Now one prescription example which we can discuss is about magnesium trisilicate powder compound NFI, that is National Formulary of India. Now this is an antacid powder. Now this antacid powder has the ingredients of magnesium trisilicate in a quantity of 25 grams, chalk powder also 25 grams, heavy magnesium carbonate 25 grams and sodium bicarbonate 25 grams. If you view the ingredients of the prescription, these are all substances or the ingredients which are going to help in combating acidic pH, which is seen generally due to acidity. So these powders are all generally helping to elevate the pH and substantially bring about neutralization of excess acidic behavior. Now the quantities being equal based on the prescription demand, the powders have to be prepared and each ingredient of the powder, which is itself in a powder form, has to be taken individually, weighed as per the demand and triturated using a dry mortar and pestle. Then each powder has to be sieved through sieve number 60, because the porosity of sieve will help us to have fine nature of the powder. Then the powder ingredients are mixed in geometrical progression. Now here, since all the ingredients quantity are same, the order of mixing will not matter because all have the same quantity and they have to be mixed equally and in geometrical progression, so that to ensure all the 4 ingredients are uniformly blended and the accuracy of dose is maintained. As already mentioned, this is an example of an antacid powder. So the category of this prescription would be antacid. So whenever a patient has a severe acidity problem, if a physician has to dispense an antacid powder extemporaneously in his clinic, he would go in with preparing an antacid powder of magnesium trisilicate compound, which is official in National Formulary of India. Now when we talk about the second type under oral bulk powders, we have effervescent powders. Now this is contrary to the previous classification which we just discussed about non-effervescent powders. So by name itself, the first difference signifies that these kind of powders show effervescence. Now effervescence is basically liberation of carbon dioxide. So we can see that when these powders are added to a glass of water, we see bubbles coming out, and that is because of evolution of carbon dioxide. So the best example one can remember, you can visualize, is imagining ENO. Now when ENO powder is added to a glass of water, you see the effervescence. So the classification which we are talking now is effervescent powders. So basically, in order to bring in that effervescent property, we have to incorporate in our formula effervescent salts. And effervescent salts is possible when we take a combination of an acidic compound and a basic compound. So here generally the recommended acidic compound is citric acid, tartaric acid combination, and the alkali substance which is generally incorporated in effervescent powder is sodium bicarbonate. So when a glass of water is taken to consume such a powder, or in the presence of water, the acid, which is citric and tartaric acid, will react with alkaline substance, that is sodium bicarbonate, and there will be release of carbon dioxide, because of which you will see the effervescence. Now the advantage of this evolution of carbon dioxide is that this makes the water having the powder carbonated in nature, as we have cola drinks which we generally call them as carbonated drinks. So it gives good taste and it helps to mask the bitterness of sodium bicarbonate and the salty taste of the medicament. So that is the advantage of going with effervescent salts, that it makes the patient feel good when he consumes such a preparation, and secondly it also impacts psychologically, because when you see something having an evolution of carbon dioxide and tasting good, it makes improve the patient compliance of the product. The two acids which are taken makes the preparation slightly acidic because it has to be compatible with our mouth pH, which is slightly acidic in nature. So the formula development is devised in such a way that the preparation remains slightly acidic and the effervescent powders become more palatable. So when we say it is more palatable, it reflects that it is more acceptable by patients, and especially when patients are children, that is pediatric, or elderly patients which are called as geriatric patients. Now one prescription example which we can discuss under effervescent type is seedless powder. Now it has a name, it is also available in the market as seedless powder. Now the powder ingredients are, or the chemical name of seedless powder is compound effervescent powder. It is official in British Pharmaceutical Codex. So BPC makes the product official. Now here generally we are going to take combination of ingredients, and because of the nature of the ingredients to react with each other, we are mentioning under powder number 1 2 ingredients and 1 ingredient separately as powder number 2. So the formula contains in powder number 1 sodium bicarbonate in a quantity of 2.5 grams, sodium potassium tartrate in a quantity of 7.5 grams, whereas we will take the other ingredient as powder number 2 having tartaric acid in a quantity of 2.5 grams. The chemical reaction which will happen when these two powders are brought together is reflected, wherein the tartaric acid having a formula of H6C4O6 will react with two molecules of sodium bicarbonate, that is NaHCO3, and it will give sodium tartarate. It will give a salt, sodium tartarate, having the formula Na2C4H4O6 with two molecules of water, that is H2O, and liberating two molecules of carbon dioxide, which is CO2. So here, since we call this as effervescent powder, there is evolution of carbon dioxide. So as we can see from the chemical reaction, that the product formed apart from salt and water is carbon dioxide, which is in gaseous form, and that comes out in the form of effervescence. Now whenever we have to handle such a powder, or whenever we have to dispense such a powder to a patient, we generally see to it that, or when we are trying to devise the formulation of this particular preparation, what we try to do is, first we take sodium potassium tartrate. Now chemically, sodium potassium tartrate, if we visualize its chemical formula, it has 4 molecules of water of crystallization. Now when this particular solid powder of sodium potassium tartrate is brought in contact with sodium bicarbonate and tartaric acid, generally this is taken in a china dish which is warm by keeping on a water bath. Basically we start the procedure by keeping a water bath on, then we take an empty china dish, we weigh all the solid ingredients one by one, and when the water in the water bath transfers heat due to conduction and convection to the walls of the china dish, the powder gets the heat source and sodium potassium tartrate liberates a 4 molecule of water of crystallization. Now this is the initiator for the chemical reaction. The water of crystallization which is coming out of sodium potassium tartrate will bring in acid base reaction between sodium bicarbonate and tartaric acid, thereby causing neutralization. So we will get a damp mass which will be then taken, the water of crystallization will escape and it will get held between the damp mass, and then that damp mass is then sieved through a appropriate sieve number and the powder is then dried. The dried powder is then packed in bulk container, and as and when required by the patient, a fixed quantity is measured out from a measuring container or a measuring device. Using a measuring device, when added to water, it will liberate carbon dioxide, thereby making the preparation pleasant for consumption. So here basically, having understood the methodology to prepare seedless powder. Now we need to understand why this particular preparation is recommended. Now as per the formula ingredients, sodium potassium tartrate is added in the formula because it acts as a saline laxative. Now laxatives are those drugs which are generally recommended for constipation. So whenever a patient is suffering from constipation, it is advisable that this powder be mixed in a glass of water and the patient consumes it, maybe once or more than once as per the need. And once the consumption is done, you will find that the patient will have easy evacuation of bowel movement and he will come over the constipation problem. And also the reason of adding the sodium potassium tartrate is because of its saline taste. Now saline taste is less because otherwise pungent saline taste is generally not acceptable by the patient, but the salineness of the preparation is taken care by addition of an acidic component. So here tartaric acid which is added in excess. So excess will help to combat the saline taste, whereas the remaining will react with the alkaline material which is sodium bicarbonate, and it will give us effervescence and also give the saline taste submerged, so that the preparation becomes more palatable or more acceptable by the patient. Now there is one more reason that we need to take care while handling this powder, of its hygroscopicity. These powders have the tendency of absorbing moisture. So whenever we talk about hygroscopic nature, when we are handling such powders, we have to be careful. So this powder is recommended not to be packed in a wide mouth bottle even though it is a bulk powder, because of its hygroscopic nature. So here the recommendation is that we need to pack it in a packet having double wrapping. Now whenever we say powder packets having double wrapping, that means the powder packet which is generally made of paper should have one inner more layer of butter paper. So we will have double layers of paper, and the powder packet has to be made conventionally with double wrapping. So the reason of using butter paper as the inner layer will help the powder to be protected from moisture and also will avoid absorption of moisture available in the atmosphere by the powder components. And also we have seen that when all the components are together, in case there is presence of moisture, this acts as a catalyst or an initiator to bring about the reaction between the acid and the base. So that is the reason why when I was mentioning about the ingredients of this particular preparation, we call them into powder 1 and powder 2. So here the recommendation is 2 packets have to be made for 1 dose, wherein powder number 1 will have sodium potassium tartrate and sodium bicarbonate packed separately with double wrapping, and powder number 2 will have only tartaric acid in double wrapping. And the patient will be given instruction that and take 1 packet of 1 and 2, rather than giving numbers, we would recommend to pack in 1 paper of different color and the other could be a white paper. So if I am making powder number 1, it would be of white paper having sodium potassium tartrate and sodium bicarbonate, and the second packet, in order to avoid confusion, I would recommend to go with a color paper, any color paper. Let's assume a blue color paper is used to pack tartaric acid in double wrapping. And then the instruction to be given to the patient would be that take 1 white packet and 1 blue packet and mix them just before use or just before time of consumption and drink while it shows effervescence. So this is the recommendation to be given to the patient. So as I already discussed the procedure, once we have dealt with the procedure, we go with the labeling requirements and the storage requirements. So storage would be very important here, and the direction would also be important.